everyone, my name is Jesselyn Wijaya, a medical student from Universitas Erlangga, Indonesia, and I want to share my experience about elective program at Hospital Universiti Kebangsaan Malaysia. In my first 2 weeks, I was in the emergency department, starting my rotation in the triage area to identify the patient initial condition. Emergency patient who could wait will be assigned in the green zone, and then in the yellow zone, patients were stable but still required urgent medical attention, and patient will be in red zone if required immediate and life-saving treatment such as trauma, breathing difficulty, shock or stroke symptoms. I also observed important emergency procedures such as fast scan, thoracostomy, and intubation. I was allowed to take medical history, observing clinical examination, assisting with IV cannulation, and monitoring vital signs. Some of interesting cases that I have met include accident trauma, perforative diverticulitis, pneumonia, Ludwig angina, Cushing syndrome, and stroke. The emergency department also have several meetings to discuss about this case of the patient. I also attend an ECG interpretation class with Dr. Faisal, which helped me to recognize abnormal rhythms of ECG. They also have several classes for the paramedic that we could join to learn about the emergency management for tachycardia or bradycardia patient, which helped me understand the importance of rapid and appropriate intervention in cardiac emergency, and they also use the simulator with AI. I also attending the pre-hospital training where I learned about the role of the ambulance team and emergency response in the field. I was shown the disaster response team card, which explained the roles of each doctor during a disaster. I also visit a room that contains various medical equipment for pre-hospital care, and we were invited to see inside the ambulance and were taken for a short tour around the hospital area. So here is the cafeteria of the hospital that we could eat several of Malaysian food. We were also invited by Prof. Khaldun in his house to have a dinner, and I would like to thank to all the doctors, especially Dr. Chow Iwan, my supervisor. For the next 2 weeks, I joined the Obstetrics and Gynaecology department. Every morning, I participate in ward round in both Obstetrics and Gynaecology wards, where I learn about how patients were monitored and managed after surgery or during pregnancy. So every Monday and Wednesday, I can join the clinic in the morning and attending the pediatric and adolescent gynecology or PAG clinic in the afternoon. I met several interesting cases, including the abnormal menstruation in epileptic patient, endocrine disorder, congenital adrenal hyperplasia, ovaria, hemorrhagic syndrome, and precocious puberty. I also attending several classes for the medical student in the ONG department, which talk about the diabetes or iron deficiency anemia. And then every Tuesday and Thursday, I observe various procedures in the operation room, including the cesarean section, hysterectomy, salpingo-orectomy, and ovarian tumor or fibroid surgery. I also observed the neonatal resuscitation inside here, and there was also airport procedure using the bigetty saving or PIPEL. These experiences helped me understand both the surgical techniques and the condition that require operative management in gynecology patient. And every Friday, I attend the family planning clinic where I learn about different contraceptive methods and observe Mirena insertion. And it is very important to educate the patient in family plan clinic. Overall, this elective program has been very meaningful for my medical experience, and thank you so much for my supervisor, Professor Lim Pei Shan and Dr. Masura Ibrahim.